Now, this is a very interesting ECG. You can simply pause and you can try to find out what is the problem in this ECG. Now, when we zoom in, what we can see, if we can zoom in to the list lead 2, what we can see, we can simply try to follow the ECG findings. Now, one thing is for sure that there is a variation between QRS to QRS. So this QRS and this difference is pretty more. This difference is pretty more. This is less, this is more, this is less. So there is definitely a variation. And if you see here, there is a large gap here. So what exactly is the problem? So in that, what we can simply try to follow is whether each and every P is followed by QRS or not. So for that, we need to find out P. So this is P wave, and it is followed by this is P, this is P wave, this is P wave. So almost before each and every P wave, QRS wave, there is a P wave. There is a P wave, and it is almost constant. So this PR distance is pretty constant in almost all the uh, complexes. If you can see here as well, this is P and this is QRS. And PR distance is pretty constant. Here also we can see P wave, we can see P wave, and the PR distance is almost constant. So PR distance is pretty constant, and almost all the QRS complexes are preceded by P waves. So this is for sure that this is a sinus rhythm, means each and every QRS is compulsorily preceded by P, means it is sinus rhythm. Or in short, each and every P is carried by an QRS complex, means this is a sinus rhythm for sure. Now, why there is so much of a gap? Why is there is so much of a gap? So one thing is sure that this is sinus rhythm. Now the second thing is there is a huge gap between the uh, R2R complexes. So this is one problem because there is a difference or there is variability with inspiration and expiration. So we know that with each and every inspiration or expiration, the heart rate increase or decrease. So whenever patient do inspiration, the heart rate increase, and whenever do patient do expiration, the heart rate reduce. This is what we call it as a sinus arrhythmia. This we label as sinus arrhythmia. But we must know that this variation of inspiration and expiration, usually heart rate does not go less than 50. Okay, but now if you see in here, how do you calculate the heart rate? It's very simple. It is 300 divided by total number of large squares. So this is one large square, 2, 3, 4, 5, 6, 7, 8, and 9 means 9. So it is almost around 40 or 35. So sinus arrhythmia won't give this much of bradycardia. So heart rate usually does not go below 50 if it is purely sinus arrhythmia. So there must be some pathological problem. So there are two things for sure. First thing that this rhythm is sinus. And the second thing is there is sinus arrhythmia. That is for sure. Means there is definitely variation between heart rate in respect to inspiration and expiration. This is also true. But this much of severe bradycardia cannot be justified only with the sinus arrhythmia. So this is there, but additionally there must be something. Now, if you can see, if you can zoom in here, 1, 2, 3, 4, 5, 6, 7, 8, 9 means almost heart rate is less than 40. So this much of bradycardia cannot be only justifiable on the basis of sinus arrhythmia. So this patient actually was an elderly 78-year male who was on atenolol 50 milligram. He was taking it daily and he had presented with syncope giddiness. So he had repeated attacks of giddiness, dizziness, uh, which was definitely attributable to the reduced blood flow to the brain. Because if the heart rate is this much lower, definitely the brain is not going to get sufficient amount of blood. So this patient, he responded very, very well to atropine. Injection atropine was given, and his heart rate normalized to around 70, 75, 80. But again, after some time, this patient again had the same rhythm continued. Now, there are two things. If this rhythm is sinus, means definitely there is not a block. Rhythm is sinus only, means P wave is generated from atrium only, but it is generated at a very low rate. So QRS is normal, means there is not a block. PR is constant, means there is not a block. But the generation of P wave, which should have been there, is not happening. Means ideally, the P should have come here, but it has not come. The P should have been come here, but it has not come. So the P must have been come here. That P wave generation is a function of atrium, means it is a function of SA node, the sinoatrial node. That is the function to create, to originate, to make a P wave, because only after P wave stimulus the QRS will follow. But in here, this SA node was not functioning well. So the SA node was actually sick. So this is called sick sinus syndrome, because in sick sinus syndrome, what we have is this severe bradycardias we can get, where it is not mandatory that the SA node will function. So patient may not have a P wave, so patient will not have QRS. So the generation of P wave is not at all sure. So the patient may have sinus pause, which is we usually call it as for less than 3 seconds. And if it is for more than 3 seconds, we call it as sinus arrest. So whenever there is no P, so no QRS, so no blood will flow to any organ, especially to the brain. So patient will get dizziness, giddiness, or in worst case scenario, patient will fall, patient will get stroke, ischemic stroke. So this is the case of atenolol, uh, you can say poisoning or overdose. But there was a component of a degenerative sinus atrial node dysfunction, which we call it as sick sinus syndrome, because the effect of atenolol should go away at least after 3 days. So even after 3 or 4 or 5 days, if still if the heart rate remains lower only, then the chances of getting the syncope, giddiness, fall, and stroke will be very, very high. So in these patients, they will definitely need a permanent pacemaker, because these patients are elderly, and the chances of significant degenerative damage, age related damage to the SA node is very high. And once that SA node, which is a pacemaker, the original pacemaker of the body, is damaged, there is no way at the age of 80, 82, 90, 91 that it will restart, because it is degenerated in a significant amount of time. That is the reason why it needs pacemaker. So this is all for today, and thank you for your listening.